If you burn your hand on a hot stove, your first instinct is never to look down at the blister and think, ah, excellent, my skin is rejuvenating.
Right. I mean, you just recognize it as tissue damage.
Exactly, you'd ice it.
Yeah.
Yet, an entire booming sector of modern cosmetic gynecology is built on the exact premise that controlled thermal damage is the ultimate key to restoration.
It's a massive industry.
It really is. So welcome to today's deep dive. We are taking on a highly specific, critically important mission based on a question that you brought to us. You asked us, can altered sensation actually happen after non-surgical vaginal tightening?
And answering this requires really cutting right through the noise of an industry that sits precisely at this collision point between commercial aesthetics and established medical science.
Which is why we've pulled together a pretty wild stack of sources today.
Yeah, it perfectly illustrates this conflict. On one side, we're looking at these glossy marketing materials from aesthetic clinics, places like the Women's Health Clinic and Sexual Wellness Centers of America.
Promising these incredible transformative results.
Right. And then on the other side, we have clinical guidelines from the British Menopause Society. We've got detailed procedure overviews from NICES, which is the UK's National Institute for Health and Care Excellence.
And stark official regulatory warnings from both the US FDA and Australia's Therapeutic Goods Administration.
It's quite the contrast.
It is, because these procedures, they're marketed to you everywhere as these quick, painless lunchtime fixes. The promise is literally that you can go in on your lunch break to address vaginal laxity or dryness or urinary incontinence.
And you're back at your desk an hour later, completely revitalized.
Exactly.
Oh.
But beneath the surface of those slick brochures lies a really fierce, complex medical debate about what is physically and neurologically happening to your most intimate nerve endings when exposed to these devices.
Yeah, to understand how sensation can be altered, whether that means, losing it entirely or developing severe chronic pain, we first have to understand the specific biological mechanisms at play.
Right. What are these machines actually doing?
Well, the clinical umbrella term here is energy-based devices, or EBDs. But they are not all using the exact same technology to achieve their results.
Right. In the sources, we see this big distinction between lasers, specifically fractional CO2, and erbium lasers, and radiofrequency, or RF, devices.
Yeah, so while the lasers use highly targeted light to rapidly vaporize microscopic moisture within the tissue, the RF devices use electrical resistance to generate heat in the deeper layers.
But regardless of how they generate the heat, the ultimate end goal is identical, right?
Exactly. It's about creating a controlled thermal injury.
Which sounds intense. The sources indicate these devices aim to heat the vaginal tissue to temperatures between 45 and 60 degrees Celsius.
Which is hot. They are intentionally inducing microinjuries in the mucosa, the delicate mucous membrane lining the vaginal canal.
Okay, so they're burning it on purpose.
Essentially, yes, because when the body detects this thermal trauma, it initiates a defense and repair mechanism. The theory relies on this process called neocollagenesis.
So the biological mandate is to rush in and repair those micro-injuries by laying down fresh collagen fibers.
Right, stimulating elastin production and significantly increasing localized blood flow to the targeted area.
It really operates on the same core logic as, microneedling your face, or even aerating a lawn.
That's a great analogy.
You're purposely inflicting structural damage just past the threshold of the tissue's comfort zone so that the natural healing response kicks into overdrive.
And the clinic brochures take this biological response and draw a very straight, very optimistic line. They claim this rush of new collagen and increased blood flow naturally leads to thicker tissue, superior natural lubrication, and crucially for our mission today, heightened sexual sensation.
But applying up to 60 degrees Celsius heat, which is like 140 degrees Fahrenheit, to highly sensitive mucosal tissue, that sounds incredibly risky.
It does. It requires a level of absolute flawless control that human biology just doesn't always accommodate. When the entire premise of this rejuvenation relies on a controlled burn, we really have to look closely at what happens when that control wavers.
Or when a specific patient's cellular makeup just doesn't react the way the textbook dictates.
Exactly. And if we cross-reference those aesthetic claims against the clinical data, specifically the FDA's MRUE database, which tracks adverse events for medical devices, the picture shifts dramatically.
It really does. The NICE overview analyzed 45 specific adverse event reports from that database, and the numbers reveal a reality that is entirely absent from the clinic waiting rooms.
Yeah, out of those 45 reports, the most common issue wasn't just a lack of results.
No.
It was pain. documented in 19 separate cases.
Wow.
That was followed by burning or numbness in 11 cases, visible scarring in 7, and dyspareunia in 6 cases.
And dyspareunia is severe, debilitating pain during sexual intercourse.
Right. And the anatomy behind those adverse events is vital to answering your question about altered sensation.
It all comes down to the pudendal nerve, doesn't it?
It does. The pudendal nerve is the primary nerve pathway running through the entire pelvic floor, branching out to innervate the most sensitive regions of the anatomy. It's an incredibly dense, highly reactive nerve network.
So if that nerve, or its microscopic branches within the mucosa, experiences excessive thermal injury, what happens?
Well, if it experiences that injury or sustained irritation from the energy dispersal of these devices, it frequently triggers a neuropathic condition called vulvodynia.
And the sources describe vulvodynia as one of the most severe and complex forms of neuropathic pain a person can experience.
Yeah, patients in the clinical literature don't just describe a dull ache. They describe feeling sharp, constant burning, or sudden, unprovoked electric shocks occurring around the vulva and the entrance to the vagina.
It sounds like a nightmare.
Yeah.
And the complications documented in the NICE reports go far beyond just a temporary loss of feeling or a passing numbness.
Oh, absolutely. The structural damage from the thermal trauma has, in documented clinical settings, caused pelvic floor hypertonus.
Meaning the muscles just lock up.
Exactly. Instead of rejuvenating, the muscles of the pelvic floor go into a state of severe chronic spasm as a defense mechanism against the localized nerve damage.
And we also see detailed case studies of tissue fibrosis in the stack, where crescent-shaped fibrous bands of hard scar tissue actually form inside the vaginal canal as the body basically overcorrects the burn injuries.
Yeah. Some women experienced a total loss of vaginal rugae, those natural accordion-like folds of the vaginal wall that allow it to stretch and accommodate movement.
And in the most extreme, frankly terrifying cases recorded in the FDA database, practitioners induced third-degree burns resulting in tissue necrosis.
Which is the actual death of the cellular tissue inside the canal.
Okay, wait. I do want to push back on this narrative of inevitable damage for a second, though.
Right.
Because I'm looking at a very specific consensus statement from the British Menopause Society in our sources.
Right. I know the one you mean.
They explicitly state that because the laser's heat specifically targets moisture in the tissue, temperatures are naturally regulated and kept safely within that 45 to 60 degree range. They write, and I quote, "The possibility of thermal damage is illusory."
Yeah.
So if a major medical society calls the damage an illusion, how do we reconcile that with the FDA reports of third-degree burns and dead tissue?
Well, reconciling that discrepancy requires looking at the massive gap between a machine's theoretical engineering and the reality of the patient lying on the table.
Okay, break that down for me.
The British Menopause Society is describing how the device is programmed to function in a sterile, perfect vacuum on ideal tissue. But thermal damage becomes very real when you introduce the two major human variables:
Which are?
the practitioner operating the probe and the biological state of the patient's tissue.
Right, because these devices are increasingly operated in aesthetic med spas or commercial clinics, not necessarily by specialized urogynecologists.
Exactly. If the practitioner sets the energy parameters even slightly too high or moves the physical probe down the canal too slowly, the heat accumulation quickly surpasses the tissue's ability to dissipate it.
And the second variable, the tissue itself.
This is perhaps the most critical part. A massive percentage of the marketing for these procedures is aggressively targeted at postmenopausal women suffering from genitourinary syndrome of menopause, or GSM.
And in this state, systemic estrogen levels have dropped significantly.
Right. And a lack of estrogen fundamentally alters the cellular architecture of the vagina. The tissue becomes incredibly thin, pale, and friable, meaning it tears easily under minimal friction.
Crucially, it also loses its natural moisture and elasticity.
Exactly. And this is where the core mechanism of the laser becomes a huge liability.
Because the CO2 or erbium laser specifically relies on targeting tissue moisture to safely vaporize and regulate its heat distribution.
Right. So if you fire it into tissue that is severely dehydrated and paper thin due to a lack of estrogen, the margin for safety just vanishes.
Wow. So what functions as a controlled microinjury in a 30-year-old with healthy moisture-rich tissue transforms into a full-thickness burn in the fragile, dry tissue
Yeah.
of a 60-year-old experiencing GSM.
Yes. The heat has no moisture to absorb it, so it penetrates deeper, instantly reaching the pudendal nerve endings. That is the exact mechanism of how you get permanent altered sensation, chronic neuropathic pain, and severe scarring, despite what the theoretical engineering claims.
So if the clinical data proves there is a highly documented risk of severe nerve pain, chronic burning, complete numbness, and painful sex, we have to ask a pretty obvious question. Why are these treatments so popular?
It's the million-dollar question.
Right. Why are there countless testimonials, daytime TV segments, and clinic reviews from women swearing this laser changed their lives? If the data highlights extreme danger, there has to be an explanation for the overwhelming amount of positive anecdotal feedback.
And the sources point us directly to an explanation. There's a landmark 2021 study published in JAMA, the Journal of the American Medical Association, that isolates exactly why those testimonials exist.
And this wasn't just a small observational study.
No, it was a double-blind, randomized controlled trial, the absolute gold standard for establishing true medical efficacy. The researchers recognized they needed to separate physical, biological changes from psychological expectations.
I was looking at the methodology of that JAMA study, and the way they isolated the placebo effect is fascinating.
It really is.
They took a group of women suffering from severe vaginal symptoms and split them in half. One group received the actual active CO2 laser treatment at the clinical settings. The other group was put through a highly convincing sham procedure.
A fake treatment.
Right. The practitioners went through all the exact same motions, inserted the physical probe into the vaginal canal, played the machine sounds, but never actually fired the laser energy.
And neither the patients themselves nor the evaluating doctors conducting the follow-ups knew who had received the active thermal laser and who had received the sham treatment.
It was completely blind.
They meticulously tracked both groups for 12 continuous months, having the women fill out standard indices for sexual function, pain, and laxity.
And the final results were definitive.
Absolutely definitive.
Yeah.
There was absolutely no statistically significant difference in symptom improvement between the two groups.
Wait, really? None at all.
None. The women who received the fake treatment reported the exact same timeline and degree of improvement as the women who had their tissue actively burned.
Wow. That perfectly contextualizes a meta-analysis highlighted in the sources by the Sexual Wellness Centers of America. When analyzing clinical trials for female sexual dysfunction across the board, researchers found that the placebo effect accounts for roughly 68% of the reported treatment effects.
68%. When you combine a highly intimate, proactive medical intervention with the expectation of a positive outcome, the brain's ability to perceive symptomatic relief is incredibly powerful.
But the illusion of efficacy isn't entirely psychological, right? There is a physical component tricking the patients as well.
Yes, definitely. When the active laser inflicts that thermal injury, the body's immediate inflammatory response causes localized edema.
So the tissue literally swells up.
Exactly. Fluid rushes to the site of the microburns.
So for a woman who paid $3,000 out of pocket to address vaginal laxity, that temporary post-procedure swelling physically mimics the feeling of tightness.
Right. She goes home, feels less laxity due to the inflammation, and combining that physical swelling with a 68% psychological placebo effect creates an ironclad illusion of a cure.
But as the 12-month JAMA study proved, it's not a permanent structural change.
No. Once the cellular swelling naturally subsides, the original laxity and dryness return, which unfortunately often requires the patient to buy another round of treatments.
This profound lack of long-term structural efficacy, combined with the severe risks to the nerve endings, is why established organizations like the North American Menopause Society contrast energy-based devices so sharply with traditional therapies.
Yeah, for symptoms of GSM, they strongly recommend traditional vaginal estrogen as the first-line treatment.
Because decades of clinical proof demonstrate that localized estrogen actually rebuilds the cellular architecture, safely thickening the mucosa and restoring natural lubrication pathways.
Without introducing any risk of thermal nerve damage or tissue necrosis.
Okay, so if the data shows a 68% placebo rate driven by temporary tissue swelling and a highly documented risk of permanent nerve damage, there has to be a massive disconnect at the regulatory level.
No, there is.
How did devices capable of inflicting third-degree internal burns ever get approved to be marketed to you as a lunchtime rejuvenation fix?
Unraveling that requires looking really deep into the FDA's regulatory pathways, specifically this controversial clearance mechanism known as the 510(k) pathway.
The 510(k) pathway.
It was designed to expedite medical innovations, but it frequently serves as a massive loophole for device manufacturers.
Because the 510(k) pathway allows a company to bring a brand new medical device to market without running the massive years-long multi-million-dollar clinical trials normally required for a new drug.
Right. All the manufacturer has to do is prove to the FDA that their new device is, quote, substantially equivalent to an older device that is already legally on the market.
And the manufacturers of these CO2 and erbium lasers utilized that exact pathway.
They did. They proved their lasers could generate targeted heat just like older surgical lasers.
Consequently, the FDA cleared these devices exclusively for general surgical and gynecological procedures.
Specifically, they were cleared for really aggressive interventions like excising precancerous cervical tissue, destroying abnormal lesions, or
The vaporizing genital warts.
yes, vaporizing genital warts, which is a fundamentally destructive medical mission. It requires high energy to obliterate diseased tissue.
And importantly, the FDA never approved these specific devices for vaginal rejuvenation.
Never. Not for treating the symptoms of menopause or for the delicate work of improving sexual function. They were strictly cleared as surgical scalpels.
But once a device is legally cleared by the FDA for any purpose, the manufacturer can sell it to a clinic.
And what happened next was a masterclass in off-label marketing. Clinics purchased these powerful surgical lasers and immediately began marketing them directly to consumers under the guise of cosmetic gynecology.
Utilizing spa-like terminology to mask the destructive nature of the technology.
Exactly.
But when health authorities globally realized the massive gap between what these lasers were legally cleared to do and how they were actually being used on postmenopausal women, it triggered a massive coordinated regulatory crackdown.
Yeah, the backlash was huge. In July 2018, the FDA issued a highly unusual, incredibly stern public warning. Then FDA Commissioner Scott Gottlieb publicly stated the agency was deeply concerned that women were being actively harmed.
The FDA explicitly called out the deceptive, unproven marketing claims.
And aggressively highlighted the severe documented risks of internal burns and permanent scarring.
And the global response really cascaded from there, didn't it?
It did. Health Canada rapidly followed suit with their own stringent warnings against the unproven claims. The Royal Australian and New Zealand College of Obstetricians and Gynecologists issued strict directives to their medical professionals,
Explicitly stating there was zero robust evidence these procedures worked, and specifically highlighting the very real risk of altered sexual sensations.
But the most definitive, sweeping regulatory action found in our sources came from Australia's Therapeutic Goods Administration, or the TGA.
Because they didn't just issue a public warning or a sternly worded memo.
No, they initiated a full, legally binding post-market review of every single energy-based device being used for vaginal rejuvenation in their jurisdiction.
And a post-market review shifts the entire burden of proof back onto the manufacturers, right?
Exactly. The TGA legally demanded that the companies providing these lasers produce the comprehensive clinical evidence proving both the safety of the thermal mechanisms and the long-term efficacy of the rejuvenation claims.
And what happened when the manufacturers submitted their data?
Well, the TGA evaluated it against the adverse event reports of nerve damage and pain, and they found the evidence provided to be fundamentally entirely insufficient.
Wow. So the ultimate result wasn't just a fine or a request to change a brochure.
No, the TGA completely canceled the regulatory approval for every single energy-based device intended for vaginal rejuvenation, legally and forcefully removing them from the Australian market.
It is an absolute stunning regulatory hammer drop. It draws a definitive hard line between evidence-based medicine and experimental aesthetic marketing.
It really does.
So bringing this massive collision of science, marketing, and regulation back to the mission you brought to us today, the question was, can altered sensation happen after non-surgical tightening?
The answer, unequivocally drawn from global health authorities, adverse event databases, and the biological realities of thermal trauma, is yes.
Yes, it can. While the marketing brochures promise collagen production and heightened sensitivity through controlled microinjuries, the medical reality is just far more dangerous.
You are exposing incredibly sensitive, often fragile postmenopausal tissue to 140-degree heat, risking permanent nerve damage, chronic neuropathic burning, numbness, and severe pain during intimacy.
For a treatment that gold standard clinical trials have proven works no better than a placebo.
Right. And when we pull back and look at the broader implications of this entire landscape, it leaves us with something pretty critical to evaluate.
What's that?
Well, the medical community heavily regulates traditional medications for women's health, right? Demanding years, often decades, of rigorous peer-reviewed clinical trials before a pill can be prescribed for menopause symptoms.
Absolutely.
Yet, through a regulatory loophole, a high-powered surgical laser explicitly approved to burn off genital warts can be rebranded almost overnight as a gentle rejuvenation tool.
And it can be aggressively marketed directly to women's deepest, most vulnerable insecurities regarding aging, intimacy, and the physical aftermath of childbirth, all without ever having to prove it actually works.
Exactly. It really demands we ask whether we are treating women's intimate health as a rigorous medical discipline deserving of the highest standards of safety and proof. Or,
Or if we have quietly allowed it to become a wildly unregulated, highly profitable cosmetic frontier. Something to think about.